Many infertility patients are related to irregular and abnormal menstruation. The relationship between dysmenorrhea and infertility. Many cases of infertility are accompanied by dysmenorrhea. The characteristic of dysmenorrhea is secondary dysmenorrhea. It is generally not primary dysmenorrhea. Even if the first few menstrual periods are painless, gradually they become painful. So, the significant characteristic of this dysmenorrhea diagnosis is adenomyosis and endometriosis. It's similar to endometrial tissue being misplaced within the uterine wall or outside the uterine cavity, such as in the pelvic cavity, abdominal cavity, or ovaries, causing dysmenorrhea. Why does dysmenorrhea occur? Because hormone levels change every time menstruation occurs. These cells, similar to endometrial cells, are called ectopic cells. They also undergo cyclic changes and shed blood, causing pain. The characteristic of dysmenorrhea is progressively worsening secondary dysmenorrhea, often accompanied by pain during intercourse, retroverted uterus, and so on. This can cause some individuals to be infertile. Why? Because pelvic adhesions occur, which mechanically hinder the pickup function of the fallopian tubes after ovulation. Additionally, they secrete certain special factors that hinder the union of eggs and sperm. Thus, it is one of the factors leading to infertility. The most accurate diagnosis is based on the history of dysmenorrhea. Severe cases of adenomyosis can be diagnosed through ultrasound. But endometriosis, where ectopic cells and tissue are located elsewhere, is not easily detected by ultrasound. Laparoscopy is the final diagnostic method. Therefore, the main diagnosis relies on secondary dysmenorrhea. For some patients, ultrasound can detect ectopic foci, chocolate cysts, or even adenomyosis. Once diagnosed, treatment becomes relatively straightforward. Laparoscopy is the gold standard. Injecting ectopic cell apoptosis inducers during laparoscopy makes the ectopic foci disappear. And with the disappearance of dysmenorrhea, natural conception becomes possible. Some hospitals categorize these cases as unexplained infertility. But in fact, unexplained infertility mostly involves endometriosis, especially when accompanied by dysmenorrhea.